Hi all, my name is Manya Redding. I'm a fourth-year medical student at the University of Kansas School of Medicine working with the Department of Ophthalmology. We're grateful for the opportunity to present our abstract titled Endoscopy-Assisted Pars Plana Vitrectomy Roll After Complicated Cataract Surgery with Dropped Lens Fragments at the 2021 Annual Icon. We have no fundings or conflicts of interest to disclose. Cataracts are the leading cause of blindness worldwide, and the number one cause of chronic vision loss in the elderly population here in the U.S. As a result, cataract surgery is one of the most commonly performed surgeries in the world of ophthalmology. Dislocation of the natural lens, also known as dropped lens, into the posterior segment during cataract surgery is a feared complication of the surgery with an occurrence rate ranging from 0.2 to 1.5%. The complications associated with a posterior cataract dislocation include glaucoma, corneal edema, and cystoid macular edema, among other issues. Dropped lenses can be managed either medically or surgically. Surgical treatment is by way of a pars plana vitrectomy procedure. The time to intervention has traditionally been dependent on the view through the cornea, which can be limited due to corneal opacity from inflammation or edema. However, the use of endoscopes have provided the ability to bypass that problem. This picture shows an example of the corneal edema that limits the view of the posterior segment. Our study aims to compare the visual outcomes of surgical intervention with PPV versus endoscopy-assisted PPV for posteriorly dropped lens fragments. We did a retrospective chart review on every patient that was treated with PPV with and without endoscopy for dropped lens fragments at KUMC for the years of 2009 to 2019. We excluded any patients that were not compliant with postoperative care. So, here we show the demographics and overall visual outcomes for all of our patients regardless of time to intervention. We had 34 patients that met study criteria, with a total of 34 eyes affected. Here we have the outcomes specific to each subgroup. At post-op day 1, we found that patients who received PPV had a statistically significant better visual outcome compared to ePPV. However, this difference disappeared at the 1-month visit. In the PPV group, one patient had residual lens material and one patient developed a retinal detachment. In the ePPV group, one patient developed endophthalmitis. In conclusion, we saw an initial difference in visual acuity with PPV versus ePPV, but this difference disappeared at the 1-month visit. Post-surgical complications also varied between the two groups. We believe that larger prospective studies would better investigate the effects of endoscopy-assisted PPV on visual outcomes for patients with posterior cataract dislocation during cataract extraction surgery. Here are the references used for this presentation. Thank you to KU for this opportunity and to the audience for your time and attention.